Hi, I'm Amy McCarter. Welcome to House Calls brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Matthew Glenn of Topeka about hyperparathyroidism. Thanks for being here today.
Thank you for having me.
Let's just start with what exactly it is.
Hyperparathyroidism is simply an elevation of parathyroid hormone in the bloodstream. This causes a reflexive increase in blood serum calcium. It can be divided into primary hyperparathyroidism, which one of the four glands is secreting too much hormone, and secondary hyperparathyroidism, which is a reflexive increase of the parathyroid hormone with decreased blood calcium.
What are some of the symptoms?
Fortunately, most of the time this is diagnosed without symptoms. As people get their general yearly physical, this is identified through an elevation in blood calcium, and subsequent testing demonstrates elevation of the blood serum parathyroid hormone. When it does cause symptoms, we may see pathologic bone fractures or fractures when there's minimal trauma, repeated kidney stones, occasionally abdominal pain or depression.
Okay. And is that how it's typically diagnosed?
Typically, it would be through the yearly physical.
Okay. And how is it treated?
Treatment depends on the underlying cause. Fortunately, for primary hyperparathyroidism, surgery is typically curable for the disease. There are some medications called calcimimetics, which can trick the body into having a increased calcium level, and that can decrease the parathyroid hormone, but typically surgery is the answer.
And how do you know at what point to call your doctor?
Anyone that's exhibiting signs such as repeated kidney stones, if they've had multiple bone fractures, or if during their blood testing they've identified an elevated serum calcium, they should see their physician.
Okay, all right, that's good information. Thank you for being here today.
Thank you very much.
Please join us next week for a new health topic discussion on House Calls.